Hi everybody, I'm North Carolina Governor Roy Cooper.
And hi everyone, I'm Mandy Cohen. I'm a doctor and I'm the Secretary of the Department of Health and Human Services for North Carolina.
Many of you might have seen us a lot on television lately, talking about the fight against the coronavirus. And when we're there, we often take questions from the media. But we know a lot of other people have questions too, and we thought we'd get some questions from some very special people today, the young people of North Carolina.
Hello, my name is Bryson and I'm 7 years old. And my question here is, what will school look like when I return in the fall? Do you know?
That's a great question, Bryson, and it's one that a lot of people want to know the answer to. And Dr. Cohen's been working on this, so she can tell you what's happening right now.
Hi Bryson. So what a good question. And so part of the answer is we just don't know quite yet what school's gonna look like, right? We have a number of months before school starts again in the fall, and so we'll have to see how the coronavirus is here in North Carolina. But we probably know school's gonna look a bit different than it has before. Maybe your desks might be further apart. You might have to have lunch in your classroom, maybe not field trips. We want to be protecting each other as we go back to school. I know that you probably miss your friends and your teachers and you're really excited to go back. We just have to make sure that when we go back that we're doing it in the safest way. It's why we're going to ask folks to wear a face covering. I bet your teachers are going to ask you to wash your hands a lot, which is great. And we want to make sure that we're staying 6 feet apart.
That's right, Bryson. We want school to be safe. We want you to be able to learn. And yeah, we want you to have fun too. All right, let's get the next question here.
Hi, I'm Gracie and I'm in the 10th grade, and I was wondering, how are students in rural areas expected to participate in remote learning with limited to no access to internet?
That's a great question, Gracie. We are concerned about a lot of rural areas that don't have access to the internet. I grew up in rural North Carolina, and so I've been fighting for those areas of the state. And we know that we need to do better. One thing we've been able to do is to put Wi-Fi hotspots on 280 school buses throughout the state to go out into rural areas and provide internet access to students. We're also pushing the internet service providers to expand their service. We'll keep working on this. We know how hard it is to do remote learning, particularly when you have a difficult time connecting to the internet. We're so grateful for all of the hard work that your teachers, your teacher assistants, your bus drivers, the cafeteria workers, and all of you are putting into the rest of this school year. And we're going to keep trying to help you. Thanks for that question.
My name's Miguel. I'm 12 years old. I'm in 7th grade. And my question is, why do we have to wear masks?
So Miguel is in the 7th grade and he's asking us why we have to wear a mask. This is the kind of mask that I wear when I am out or at the Emergency Operations Center. And we think everybody should wear a mask, particularly when you're going to be out of the house and you're going to be around other people. And the main reason is to protect other people. It's a nice, considerate, kind thing to do. We want everybody to do it to protect people, but it's being nice to other people when you wear the mask.
And you can see mine's homemade. My mom made this one, she sewed it, and you can see it's even with hair bands. So you can make these at your home or you can buy them at the store, talk to your parents about that, but it's gonna be important that we not only wear this, but you gotta wash your hands also. So you can't forget to do the other stuff like washing your hands when you're wearing this mask. And when you take it on and off, you wanna take it on and off from your ears, right? Not from the part of the face. So when you take it on and off, make sure you're taking it off by the ears so we don't touch the front of it. But wash your hands, and wait 6 feet apart from other people. You got this, all right.
Hi, my name is Venus. I'm 18, and my question is, how is North Carolina prepared to handle a second wave of COVID-19, if there is one?
So Venus is asking us about a potential second wave of coronavirus. Dr. Cohen?
Well, the good news for North Carolina, because the governor took early action to make sure that we stay home, we didn't see a first big surge of COVID-19 here in North Carolina, and that's a great thing. We all slowed the spread of the virus together, but we're ready if that virus comes back, right? So first, we wanted to make sure as we ease restrictions, we do it slowly. We want you to wear a face covering, we want you to wash your hands, we want you to wait 6 feet apart. But then we also want to make sure that if you have the symptoms of COVID-19, a cough or a fever, that you can get a test. And importantly, we want to make sure that the doctors and hospitals are there if you need them. So we've been working hard to make sure all that's there for you as we go through this. So thanks for that question.
Here's another question.
Hi, I'm Sophie, Governor Cooper. I have a question for you. How come coronavirus doesn't affect kids as badly as it affects adults?
Wow, I've seen Sophie before. I know who she is.
Hi, Sophie. It's Mom. Great question. So of course you asked the hard one that we don't know all the answers to yet, but you're right. Kids don't seem to get sick in the same way adults do from COVID-19, and that's a good thing, right? So kids largely don't get really bad symptoms of COVID-19, but we are still trying to understand why is that? We think it's largely because kids don't have some of the diseases that adults have, like high blood pressure or diabetes. And so kids are able to fight off COVID-19 easily. But that doesn't mean that we don't have to do our part to help protect everyone, because maybe mom or dad might have asthma or diabetes, or grandma or grandpa. They might be at higher risk. So we have to all do our part, not just to protect ourselves, but our families, our friends, our neighbors. So that's again why you want to make sure you're washing your hands for 20 seconds or using hand sanitizer. Staying 6 feet apart from your friends, which I know is super hard, and then also wearing a face covering so that just in case you have germs, you don't give them to other people. Thanks for the great question, Sophie. Love you.
We got some great questions today, and Dr. Cohen and I enjoyed answering them. We also appreciate your parents and your caregivers who are also answering tough questions that you might have. And your parents, I know, are homeschooling you now. That's tough work, and this has been a hard time for everybody, I know. But if we look after each other, if we're kind to each other, if we help each other, we can all make it through this even better than we were before. Thanks so much.